Hello everyone. Today we are going to be talking about infectious diseases manifesting in the GI tract, non-helminthic, which means they are not caused by worms. This is going to be chapter 23. First thing we're going to talk about is where does digestion start? It starts in the mouth. So the first thing we're going to talk about is dental caries. It's also known as tooth decay. The deeper the lesions cause infection in the soft tissue part of the tooth, also known as the pulp. The deeper the infection goes inside of the tooth, can cause what we know as a toothache. And if you've ever had one of those, you know what that pain is like. The two main causes of dental caries include Streptococcus mutans and Streptococcus sobrinus. And I hope I'm saying those right, but those are two different types of bacteria. A little more on dental caries. Dental caries can appear as soon as our teeth do, about the age of 6 months, depending on the child. Everyone's different. Some can be up to 2 months early, at 2 months of age, and some can be a little later. But anyway, whenever we do start to develop those teeth, we are prone to dental caries. Nursing bottle caries, they're acquired by drinking formula or juice before and after bedtime. That's why no pediatrician is going to recommend a bottle right before bed or nursing or anything like that, because this can cause those dental caries. Dental caries are very worldwide. Factors that contribute to dental caries include hygiene. How much are we brushing our teeth? Are we even brushing our teeth at all? And you would think here in America, we're pretty adapted to dental caries and we brush our teeth regularly and things like that. Based on patients that I have seen, that is definitely not true. Genetic factors, maybe we have some kind of gene condition that makes our bones a little softer than others, so maybe we're more prone to dental caries. Carb consumption, of course, how much sugar are we eating, because that just sticks on there and builds up. Several different things also, different habits such as drug use, smoking, those kind of things also contribute to our dental caries. Periodontal disease, 97 to 100% of the population have some manifestation by the age of 45. So no matter how much we're brushing our teeth or what we're doing, we all basically have some form of periodontal manifestation by the age of 45. The initial disease is gingivitis, and gingivitis includes the redness, increased bleeding, swelling, those kind of things. And we live in a society now where we want white teeth. We think those things are very important, and they are to our self-esteem and things. But a lot of times when we use those chlorinated or bleachy-based products to whiten those teeth, this can also increase our risk for gingivitis, or if we already have it, make our symptoms worse. The higher number of bacteria associated with periodontitis have increased the risk for cardiovascular disease and thickened carotid arteries. So there is actually a link between our oral hygiene and our heart. Mumps. Most cases occur in children less than 15 years of age. Of course, there is the MMR vaccine, that is mumps, measles, and rubella. It is a requirement for these vaccines before school, but however, you have your religious exemptions and things like that, so not every child is vaccinated. But the first vaccine is recommended between 12 and 15 months of age and 4 to 6 years of age for the second dose of this vaccine. And there are several different ways to diagnose, but the two main ones are based on the ELISA for the IgM or the PCR cheek swab. All right, gastritis, gastric ulcers, and H. pylori. Sharp burning pain from the abdomen is one of the main signs of any of these. H. pylori is a curved gram-negative rod bacteria. H. pylori occurs in the stomachs of 25% of healthy middle-aged adults and 60% of adults over the age of 60. It is transmitted by oral to oral or oral to fecal routes. This is known as the familiar bacteria because it is a lot of times family based. So a lot of times, like someone may not realize that they have this. Let's say that they are getting butter and they lick the spoon, put it in the butter, grab the butter, put it on their corn on the cob or whatever. Who's to say that the H. pylori is not in the butter now? So then little brother comes along, he wants butter on his toast, he grabs the butter. Can it sustain like that? I'm not sure, but I think that's one way that we can pass it along. And I think that's why it is so familiar within families. It is treated with amoxicillin, clarithromycin, and acid reducers. Normally, those are recommended to take at one time together. Acute diarrhea. At some point in time in every single one of our lives, we have experienced acute diarrhea. 3 or more loose stools that happen in a 24-hour period is the true definition of that. Tropical countries, children may experience it more than 10 episodes of diarrhea per year. So they're more prone to this. Maybe because the bacteria percentages are a little bit higher. A little bit of contamination with that water. I mean, different things can contribute to it. In developing countries, 700,000 children die from diarrheal disease per year. They can't just go out to the store and buy Gatorade or Pedialyte or things like we can. So that definitely causes the uptake in deaths. Up to 1/3 of all acute diarrheal cases are caused by contaminated food. So let's say we're at a picnic and we're eating sandwiches and we leave the mayonnaise out maybe a little too long in the 80-degree heat, we possibly could get some acute diarrhea from that. And that would be an example of a contaminated food. Salmonella. That thing that looks like the Cheeto on the fork is actually the example of the Salmonella bacteria. Normally, normal intestinal biota in cattle, rodents, reptiles, and poultry. And every time that I cut chicken on the counter, we know that chicken and salmonella are just linked. I don't know why, I just always link those two, but every time I'm cutting raw chicken up or something, I'm like, ooh, salmonella. So, and one of the things we can definitely do by handling these raw meats and things that have the potential to be contaminated is definitely washing hands with soap and water. Reptiles. My son loves snakes. He loves, I don't know, he likes going and seeing the snakes and petting the snakes and things like that. And that's another reason it is so important to wash our hands and do such good hand hygiene, because we don't know when we're coming in contact with a reptile or something that could have salmonella. The symptoms of this usually subside in 2 to 5 days. Meat can be readily contaminated. Milk and eggs are 2 of the common traceable food sources of this. And ciprofloxacin is given usually as a treatment if it doesn't subside in those 2 to 5 days, and it is determined that it is salmonella. Shigella. I actually think this bacteria is very pretty. It reminds me of feathers. However, this can be a tough little cookie. The symptoms of this include nausea, vomiting, frequent watery stools, fever, intense abdominal pain, diarrhea containing blood. Treatment can include amoxicillin or ciprofloxacin for this. It can spread rapidly in crowded areas such as daycares, military camps, nursing homes, places where everyone is in close quarters and stuff like that. It is not common really as much in the United States. It is more common in the Eastern Hemisphere. The Shiga toxin producing E. coli, also known as STEC. The symptoms include fever, gastroenteritis, bloody diarrhea. We can have even severe symptoms such as blindness, a lot of neurological conditions such as seizures, and even stroke. We can acquire this by ground beef, eating raw vegetables, apples used in a cider that have been unpasteurized. So again, it's so important to make sure that we cook meat thoroughly. Those raw vegetables, we go out and we just pick them and we think, oh, they're good, just throw them in a bowl. It's so important to wash and rinse those vegetables. And this bacteria can be confirmed with the PCR or the stool culture. Campylobacter. Symptoms include watery stools, fever, vomiting, headaches, severe abdominal pain. This is an example of them over here to the right side, just up above me. They actually look like little worm-like structures. It's the ingestion of contaminated food or drink, such as milk, water, or chicken. In small numbers, this bacteria can cause Guillain-Barré syndrome, which is a very severe neurological disease that can have lasting repercussions. So these little bacteria may seem like, they don't have anything, but they definitely carry a powerful punch sometimes. In simple cases, we just need rehydration. Just get you a couple IVs or some Gatorade and we'll be good to go. In the severe cases, azithromycin may be given, and possibly other antibiotics if the azithromycin does not take care of that for us. Clostridioides difficile, also known as C. diff. If you've ever worked in any kind of nursing facility or any medical place in your entire life, you know what C. diff is. And that is an example of it in the bowel. It is a horrific, nasty diarrhea that is usually brought on by a broad spectrum of antibiotics. A lot of people, let's say they have chronic lung disease, let's say they have COPD and black lung and a couple of other emphysema. They have all these things. They're usually on a strong, broad-based antibiotics and a variety of them. That is an example of these things that can bring on C. diff. Fecal implants or stool transplantation from healthy donors is the treatment with the most success. So it's kind of interesting. Cholera. Symptoms begin abruptly with vomiting and copious watery feces. So secretory diarrhea, also known as that. If left untreated, death can occur in less than 48 hours because you have so much diarrhea and so much vomiting. You have to get rehydrated. Mortality rate is between 55 and 70%. Most of the time, that is not within the United States. Again, that is in these developing countries. Vaccines are available for travelers that are going to these countries. They're also available in the United States, but we don't have a lot of cases here of cholera, so it's just mostly for the travelers. Treatment is replacing fluids and electrolytes. Again, these countries they can't just run to their Walmart or wherever and pick up a Pediasure or Gatorade. They can't just pick that up. Can't get liquid IVs and stuff like we do. So it's very important that they rehydrate because the death rate can be so quickly, less than 48 hours, if they don't get that. Cryptosporidium, it's an intestinal protozoan that affects mammals such as mammals, birds, and reptiles. And again, I talked about reptiles a while ago. It's so important that we wash our hands and stuff after handling these, not just snakes, but all reptiles in general, turtles, frogs, whatever. Humans ingest the bacteria accidentally from water or food that has been contaminated by feces from infected animals. So, again, if a snake's been out in the water that has this and you drink that water not knowing that that's there, that's another way you can get infected. The agent can be detected in the fecal samples or biopsies using, again, the ELISA or the acid-fast staining. Rotavirus. Rotavirus. This is an example of it over here. Looks like the big circle with little spikes all over it. It is transmitted by the fecal oral route, and it's usually for babies between the ages of 6 and 24 months are at the greatest risk of mortality. Symptoms include watery diarrhea, dehydration, fever, and vomiting. And we know if an infant or a 7-month-old baby becomes dehydrated, things can go downhill very quickly. Treatment includes oral replacement of fluids and electrolytes. Vaccines are available, and I have given those vaccines before. They are actually oral type vaccines. They just come in a little liquid, and you just kind of put it inside the baby's cheek until it's in a little vial. It only comes about this big, and you just pop the cap off of it and just a drop or two at a time until the baby swallows it, and they're vaccinated.